so the next step is our microneedle therapy. So our microneedle comes in a nice protective case. So what you want to do is have it on a nice firm surface before you lift the tail end up. Okay, you do not want to open it mid-air because you will drop your microneedle. Now once you open your microneedle, it's probably easier for the treatment purposes to sit it on a towel rather than to keep putting it back in the cradle. Okay, so sit it on a nice soft surface. You wouldn't want to put it on a hard bathroom surface or wood or anything like that because it can blunt the needles. So this has got 196 tiny little microneedles. They're acupuncture needles and they're designed to create channels down through the scalp. So we've actually cleaned the surface of the scalp, we've opened the follicle, so now we're going to channel down through because everything is about getting effective absorption down to our target site in the dermis. So for our microneedle therapy, if you're treating female and male pattern thinning, your treatment area is to your crown or fingers width back down to your ears. So it's that little triangle and down the other side. When you're doing the hair cycle, we want to do it everywhere. Now we find it is easier to break it down into quadrants. So you've got this quarter, that, and you walk all of the way around the head. I find it best to start from a center section, so you just give yourself a nice part. Most of us have a comb. This is my amazing giant comb, or you can use something like a little tail comb. So you just make your sections. Clip it back if you want to, tie it back. Obviously it's much easier with shorter hair, but very, very possible with longer hair. I do this treatment myself, so it can be done. And we just separate it. Now we're going to start in the female pattern thinning area first. Now keep in mind, the scalp is still cold, it's freezing from the tonic, so you've got to work fast. You can't go and have a break and then come back, and it should be done on towel dried hair when you just get out of the shower. So it's the first thing that you do, and we grab our microneedle, and what we want to do is do little rolls backwards and forwards, and you need to go over each section about 3 to 4 times. So it's a slight pressure, you need to feel it, but you certainly don't press hard enough that you're going to draw blood. Now in clinic we do this treatment for our patients as well. Obviously it's much easier for us to do this for you, but definitely possible at home. My background is I was a hairdresser 26 years ago, so I know how to use a tail comb. You may not, so it might be easier for you to use your fingers, but it's certainly worthwhile giving the tail comb a go. If you just want to use your fingers, you just go in section. So you can see that the sections are probably 1.5 centimetre, which is about the diameter of the roller. So we want to make sure that we're overlapping. You might see in there as well that the scalp is turning slightly pink. That's exactly what it needs to do because again, we're triggering all the action. The microneedle also creates a natural injury reaction, so it gets all the collagen and all the healing properties happening without any chemicals. Now I personally will not do any topical applications without doing the microneedle first. If you're going to go through the effort of buying a product, preparing your scalp for it, you want to make sure that you get the proper absorption. So just in here, some of the hairs can get caught, so you just tuck them out of the way. Coming into the side, there's less hair, so you can move the microneedle around, take slightly bigger sections. You might see Sarah wincing a bit there. It's a little bit tender around the temples. There's not much adipose fat tissue in those areas, and the skull is pretty close to underneath that layer of skin. Just on those sides, we just angle up a little bit. Again, you can feel and see the warmth underneath the scalp, so you know where you've done the microneedle. So if you're just doing pattern thinning, you would move from this side over to the other side. If you're doing the whole hair cycle, you would then move in to your next quadrant. It's easier to work around the scalp. So we go back from the top. Again, doing it by feel. I find it easier to work in kind of rows this way. Some people like to go that way, but I find on longer hair it's harder. You need to devise whatever works for you, keeping in mind once you've used the microneedle, it leaves behind the feeling of heat on the scalp, so you can tell where you've been. So it's just that motion. Always use that bit of pressure, but never enough to draw blood. Just on that, the scalp microneedle is a different length of needle to one you would use for skin therapy. So the longer the needle is for scouring and different things like that. So we don't want to use the long needles. This is 0.75 millimeter, and that is more than enough for a scalp roller. Of course, we have our own brand, but there's many, many available. So as long as you're using one that is designed for the scalp. And the other thing about the scalp roller is it goes blunt after about 180 uses. Your scalp skin is tough, and it does blunten the needles. What happens when the needles get blunt is it starts to actually hurt more, and it's no longer effective. So always count your uses, like how many times a week do you use it? Do you use it with whatever products and how much? You know, there's many ways of counting. So you just work your way through, always doing, said 2 to 3, 4 passes, and you can just feel it. Probably easier just to hold the hair up out of the way with your hands rather than use clips, because again, you need to work fast. The first few times you do this might take you a bit of time, so don't panic, but I guarantee you it gets easier and easier and easier every time you do this. Some people do this every second day, some people do it every third day, some people once a week. It depends on your diagnosis and what you're treating as to how many times you would do this. So again, you can communicate with me about that. You then at home would continue over here and then to here once you finish, but we won't show you that today. Once you finish with your microneedle, back in the cradle and with the lid on. Now the microneedle is clean because you've cleaned your scalp. However, if you do want to clean it, you can use denture cleaner, but always make sure it is dry before you put the lid back on. Next step is our start of our topicals. The first one we're going to use is Active Arts. Be back soon.